Hi folks, in this final video on systemic blood vessels, I'm going to show you some human artery blood vessels. And I'm going to focus on the differences between the human and the cat. You've already seen the blood vessels, both arteries and veins in the cat. And I'm going to be showing you human arteries in the upper body that are visible in angiogram x-rays. So let's look at one of these angiograms. So here we see an angiogram of the arteries superior to the heart. The heart is located here. We can't see it in this x-ray. And here's the aorta. Now in an angiogram, the blood vessels are made visible in an X-ray image by introducing a contrast dye into the arteries, and that makes them visible in the X-ray image. So we always have an orientation in X-rays, and so here we know this is the left side of the body, here is the right side of the body, and this person, although they're facing you, they're not in the standard anatomical position. Well, first of all, their right arm is abducted, and also their head is turned to the right. So we're seeing the right side of their face. Now I'll be using this model here also because what we're going to do is we're going to view these upper body arteries, and I'll be naming them, and I just want to use this to illustrate these arteries that come off of the aorta, because that's really where the difference lies between the cat and the human. So let's start naming some of these blood vessels. So there's the aorta in the model, and I'm going to focus on this aorta and these three arteries coming off of the aorta. So let's move this a little bit closer. Okay, now this first artery that comes off the aorta is called the brachiocephalic artery. And you did see these arteries when Professor Langyard demonstrated the heart in the first video of this series. Okay, now the brachiocephalic artery, we have that the same in the cat and the human, as we'll see in the next slide. So here, brachiocephalic artery, first artery coming off of the aorta, going in the direction from right to left. Here we can see it over here on the model. The second artery coming off of the aorta is the left common carotid artery, and here we can see it coming off of the aorta in the model as well. And then moving further to the left side, we have the third artery coming off the aorta, the left subclavian artery, and here we can see it in the model. So now let's name the rest of these arteries that we can see in the upper body. So we said this was the brachiocephalic artery, and it branches. It branches into this right subclavian artery. That here we have the sternal artery coming off of that. Here is the right common carotid artery, which is in an anterior position compared to this artery, which has a posterior position. This is called the right vertebral artery, and I know it's that artery because I have a clue. Here are the vertebra, the cervical vertebra, and the cervical vertebra have transverse foramen in their transverse processes, and those are openings for this vertebral artery to move blood up into the brain. So you see we have two arteries that bring blood to the brain on the right side, the right common carotid artery and the right vertebral artery. So here, moving in towards the left, we have the left common carotid artery. So here's the right common carotid artery, here's the left common carotid artery, again having an anterior position compared to the vertebral arteries. Here's the third artery moving from right to left, the right subclavian artery, and it, although it continues down into the, to become the axillary artery, here it gives off a branch, the left vertebral artery, again extending through those transverse foramen in the cervical vertebra. So here's the right vertebral artery, and here's the left vertebral artery. I did point these vertebral arteries out in the cat, but we could only see this very proximal position or part of those vertebral arteries because they do course very posterior down into the muscles. So now let's compare these upper body arteries in the human and the cat. So here's a close-up of the cat arteries filled with this red rubber latex. Here's the aortic artery, the aorta. Here we see a little bit of the right atrium, although the aorta, you should know by now probably that the aorta is the vessel that is draining blood from the left ventricle. Okay, so the aorta in the cat, just like in the human, the first artery coming off of that aorta in the right to left direction, this is the brachiocephalic artery. And in the cat, this artery then gives off 3 branches. And so here we'll follow that brachiocephalic artery. This is now the right subclavian artery. This branch is the right common carotid artery, and this branch is the left common carotid artery. So in the cat, the 2 common carotid arteries branch off of the brachiocephalic artery, whereas in the human, only the right common carotid artery comes off the brachiocephalic artery, but the left common carotid artery comes off the aorta. So here's the left common carotid artery in the human, but here's the left common carotid artery in the cat. So if you took this left common carotid artery in the human and detached it and instead attached it up here on the brachiocephalic artery, that's the situation you have in the cat. So a little bit of a difference there. And then finally, we have the third artery coming off the aorta in the human, the left subclavian artery, but the cat only has 2 arteries coming off the aorta, the brachiocephalic artery, and here is the left subclavian artery. So the left common carotid artery is kind of missing here coming off of the aorta. Instead, it's up here coming off the brachiocephalic artery. In the cat, we can see the 2 vertebral arteries. Here's the right vertebral artery going posterior, and here is the left vertebral artery, again coming off of the left subclavian artery, and we have the the sternal arteries cut here in this specimen. Now I want to show you some other arteries in the angiograms in the human. And so these arteries we could not see very well or at all really in the cat. And so it's nice to see these in the human in the angiogram. So this is the left common carotid artery, which courses off of the aorta in the human. And then up here, right at the junction of the cervical region or the neck and the head, we see that left common carotid artery, it also occurs on the right side. This branches into an internal carotid artery, which brings blood to the brain. And here's the external carotid artery, which brings blood to the superficial structures of the head, like the face.